is Indian country today.
Esquili, yes, thank you for joining us. I'm Patty Thalahungva. The Senate passes a legislative package that includes 4 bills prioritizing the health of Native Americans. The Indian Water Rights Settlement Extension Act will expand healthcare coverage for veterans and tribal school employees. It will also provide funding for 2 water development projects. In addition, the Indian Health Service can now enter into agreements with other federal departments to ensure veterans receive medical care at urban Indian health centers. The bill also allows tribal school employees to participate in the Federal Employee Health Benefits Program. The package also amended an act to provide an additional $137 million for the construction of water projects in New Mexico. That project addresses water rights issues in the pueblos of Nambe, Powaki, San Ildefonso, and Tesuque. The Navajo-Utah Water Rights Settlement Act authorizes nearly $200 million to create Water Development Fund. 16 other bills in the package are now waiting in the House of Representatives. A Native American children's book is set to be released next year, and we're getting a look at the cover. Ancestors Approved Intertribal Stories for Kids is the name of the book, edited by Cynthia Lytek Smith, who is Muskogee Creek. She describes the book as an international or intertribal powwow. The collection of stories celebrates friendship and family, culture and tradition, intergenerational relationships, and the wide-ranging diversity within today's Native American and First Nations communities. Some of the Native writers who are contributing stories to the book include Eric Gainsworth, Rebecca Roanhorse, Art Colson, Tim Tingle, and Don Quigley. The publishers of the book is a grassroots organization called We Need Diverse Books. The organization advocates for literature that reflects and honors the lives of all young people. The stories are illustrated by Nicole Neidhart, who is Navajo, and the book will be released the first part of February 2021. And now for the latest numbers of COVID-19 tests, let's go to Jordan Bennett-Begay, our Washington editor. Jordan?
Patty, so 5 tribes announced more cases and deaths within their communities. Here are the latest numbers from our database. There are 9,012 positive confirmed cases and 353 deaths in the Indian health system. Again, that is a total of 9,012 positive confirmed cases and 353 deaths as of June 9th, Patty. The Mississippi Band of Choctaw Indians in Mississippi have 3 new cases and 1 additional death. That brings their total to 740 cases for the tribe and 41 deaths in total. In Washington State, the Yakama Nation has 106 positive confirmed cases and 5 deaths. When we last reported on May 19th, the Yakama had 90 cases and 3 deaths. The Colorado River Indian tribes in Arizona announced a total of 140 cases. In the last 24 hours, the tribe reported 38 new cases. Crit said these recent cases are all people who live on the Colorado River Indian Reservation. The Navajo Nation that spans Arizona, New Mexico, and Utah, parts of Utah, are reporting 90 new cases. Tribal officials say they have a total of 6,110 cases and 277 deaths. And the White Mountain Apache tribe in Arizona announced 21 new cases and 3 more deaths. That means the tribe has now passed the 100,000 mark of COVID-19 cases. They have a total of 1,003 cases and 12 deaths now, Patty. And it's really interesting, too, that the Arizona Department of Health Services says the White Mountain Apache tribe has approximately 13,420 people in their primary care area. And this primary care area is a geographic area where residents look for primary care health services. And the tribe's reservation, the Fort Apache Indian Reservation, is a 3-hour drive northeast of Phoenix. And when we consider the numbers and we do the math, the White Mountain Apache tribe has an infection rate of 7.47%. And they're traveling long distances to try to get this, and they're doing as much as they can to mitigate the spread of the virus right now.
And once again, the White Mountain Apache tribe has now surpassed 1,000 cases of positive COVID-19.
The tribe is doing its best, to mitigate the situation, and this is also happening as the state of Arizona is in the reef opening phase too.
Jordan Bennett-Begay, thank you so much.
Ikehet.
And we'll be right back.
This is Indian Country Today.
Welcome back. It's been 3 months since the novel coronavirus hit mainland USA. This global pandemic closed the economy. People have been staying at home or practicing social distancing. And of course, everyone is vigorously washing their hands, and many are wearing face coverings now. In Hawaii today, like many other states, businesses are reopening and people are venturing out. How is the medical community dealing with the pandemic now? Joining us today is Dr. Lene Lawrence. She practices teleprimary care at the VA Pacific Islands Healthcare System in Honolulu. Welcome, Dr. Lawrence.
Thank you, Patty. Good to be here.
What is your advice now, as people are venturing out into the public where the pandemic is still going on and yes, they are wearing face coverings and such, but what's your best advice when it comes to restarting and going back out into the public?
Well, here in Hawaii, the numbers have luckily been very low. I think we're one of the lowest states per capita with coronavirus infections. But the government has been, very proactive in shutting things down early and extending the stay-at-home orders. And so the best advice still really is to stay at home. And then going out in public, of course, you want to make those trips only as needed and to wear the face masks, keep your hands washed, minimize that contact as much as possible.
And are people there following that? I know that you're involved with the Native Hawaiian community there as well. Are they also following these rules?
Everybody in Hawaii has been really good about following the rules. You can't go into any business without a face mask, but people are also wearing them obviously out in public when they're out exercising. So everybody's following them really well, which is very encouraging and why we're able to keep the numbers low, I'm sure.
And so that sounds like it's a good sign there. Now, 3 months into this, we look back to March and the information that we were getting about the coronavirus was, very little, but kind of scary. Since March, what have we learned? What has the medical community learned about this virus and how it spreads and how it affects people from different age groups?
Well, it's still ongoing, everything that we're learning, obviously, because it's so new and the virulence of the virus was pretty strong and it affected so many people. Every day there's something new. Initially, of course, they thought there was a lot of, you could get infected by contact surfaces. That seems to be kind of going down in suspicion as a mode of transmission. Even how to treat the virus, some of the medications that they were using. Most recently, one of the newest things that I heard was that putting people on ventilators early may have actually been hurting them. So, there are things changing all the time as far as how to treat the virus, its mode of transmission, several things that are continuing to come out on almost a daily basis.
And it's almost so hard to try to keep up with what's going on,
Right.
and the information that's coming out. What are some of the misconceptions that you've heard about that you had to talk to your patients and let them know, no, this is not true?
Let me think. I think, there's not a lot that I can recall. And I'm digging deep in my brain. As you can see, I'm thinking back. I don't hear a lot of misconceptions. The ones that have been out on social media about drinking hot water, those type of things. I never really heard voiced to me if that was really, true or not. So I think people are really filtering through the mass of information and figuring out, what is true and for the most part, and what is not true.
Mm-hmm. And following the CDC guidelines, do you think that's where most people are going to get their information?
I think, yes. And then the local states are really very good at getting the information out. So, we have, obviously here in Hawaii, we have the state health department putting out information all the time every morning almost on the local news channels with, the latest recommendations and what the latest rates are in Hawaii and how things are going and plans on moving forward and reopening. So I think the states, for the most part, well, at least here in Hawaii, are really good with getting the information out and making sure that people know how to act responsibly.
Okay, and the whole idea of telemedicine, that's been, of course, in use for a long time now. But has this pandemic increased that use of telemedicine?
Oh, by leaps and bounds. We had, with the VA, we actually had implemented a telemedicine program that's a little bit different. Normally, we provide care to veterans in the clinic via telemedicine. There's been, since about 2018 or so, there's been a push to do more what we call visits to the home, CVT to home. And so we had implemented a program here in the VA, the first of its kind, where we could call the veteran at their home or, wherever they happen to be if they had a smartphone. And it's, I actually make quite a few calls to veterans in their cars because they're out and about and it's time for their visit, and, they just sign into the virtual medical room. So we implemented that program in 2018, again, a first of its kind in the nation. We are very proud of that. And it was just, it was, something that we just brought back with roaring success when the pandemic hit. And we started closing the clinics, the ambulatory care clinics, and everybody was sent home to telework. And obviously that flooded the telephone advice nurse line, which is the program that we worked on. And so we started getting a lot more visits to the home. And then we also did a program earlier in 2019 where we taught all of the ambulatory care physicians how to do these types of visits in particular. And so everybody was pretty well prepared. There was a few things that we had to do some renewal training on. And when the clinics closed, all the appointments were converted to telemedicine. And so not only myself, who specializes with telemedicine, but all the ambulatory care physicians also started doing CBT to home and phone clinics. So the numbers, I think we increased our telemedicine visits overall in the VA by almost 100%, if not more than that.
Wow, that sounds pretty successful there. And
Yeah,
how are the
so.
patients? How are the patients reacting to this telemedicine?
So the veterans have always really loved telemedicine that we've been doing to the clinic, because we have just a little bit more time for those visits. We have peripherals like a stethoscope and an otoscope, a camera if we need to look at anything, even on the skin. And we depend on the nurses in that particular clinic to work that equipment. And so we need a little extra time to be able to complete a visit. And because of that, we're able to share more, time with the veteran. And so they really love those visits. Now, with the CVT to home visits, they have really been appreciative of it. It's rare if we get anybody that does not like it, but, they, for the most part, 99.9%, they love those visits and being able to have access to, continued access to the telemedicine, teleprimary care physician or their own physician. So they're very appreciative of that fact.
Is this a program that can be replicated in other VA hospitals on the mainland here? Because of course, as Native Americans, we have a high rate of military service. And so we have a large number of veterans. Is this something that is being replicated or can be replicated?
Well, yes, VA is very progressive in the use of telemedicine, and they have a national program that pushes out these programs to all the various what we call VISNs throughout the nation. So it is being implemented throughout the VA nationally. Everybody has pretty much their own telemedicine program for the most part, and doing the CVT to home calls. So we stood up telemedicine pretty quickly and vigorously even before the pandemic, and we were prepared. So that's the good thing about it.
So do you have any information on which VAs that service large Native populations are using this kind of medicine?
Well, I know Montana is, because actually I came from Montana. I came to Hawaii from Montana, and when I transferred to the VA, that was the very first teleprimary care program in the whole of VA. So I was lucky to be in on that, which actually got me this job here in Hawaii. So because they were standing up their telemedicine program here in 2017. So, but yeah, so I know Salt Lake City, they service Montana. So I'm pretty sure, Arizona has a great telemedicine program. And of course, all of the Southwest tribes are benefited by that. So it's pretty much nationally.
Okay. Well, the one thing you can't do through telemedicine is actually test, conduct the COVID-19 test. So how is that going in Hawaii?
So what we did was through our CVT to home program, when they would call the TAN line with, complaints of any respiratory complaints, we had 2 arms. And one of them, if they had any respiratory complaints, they went down one pathway and were triaged for the COVID-19 symptoms. And if they had those symptoms, we did have a drive-through testing set up at the ambulatory care clinic, and we would enter the orders and they would go through the drive-through testing. The other arm, obviously a lot of veterans have chronic medical issues. And so that was the other arm. If they weren't calling in for, COVID-19 symptoms, they went down the other arm and would, get regular care that way from the teleprimary care physicians.
All right. So, and is testing readily available there?
Yes, testing is readily available at multiple locations throughout the islands.
That's one thing the Indian country is really struggling with. Some tribes are fortunate to have testing, and other tribes are still trying to get those test kits. So it's been a big issue.
Right. Yeah, we're very fortunate that way here in Hawaii.
Now, we've heard from a lot of different people about how Native Americans, Alaska Natives, are turning to traditional forms of medicine in this time. So are you hearing and seeing the same thing in Hawaii?
I can't say that I have seen that. They do have a really wonderful Native Hawaiian Center of Healing in West Oahu in Waianae. And I've not really heard that they've been doing a lot of traditional medicine healing practices. So I'm not sure about that.
All right. Well, so now we're in the middle of this pandemic, and now we have all these protests going on across the country for, looking at police brutality against the Black community, but also, Native community. It's also the case with Native Americans. And we're looking at the video of this, and people are all out there not practicing social distancing in a protest march. And some of them are wearing a face covering, others are not. What are your concerns when you're looking at those images and understanding that we have no vaccine yet?
Right. Well, obviously you hit on everything, the close proximity of one person to another, and they're not wearing masks, really large gatherings. It'd be kind of hypocritical for me to say too much more about that, because I have 2 grandsons who wanted to participate in a march locally. And, I had to take everything into account here in Hawaii, what our numbers were, which have been very, very few numbers. The fact that, we were outdoors with a lot of space, in some of the larger cities, they're really crowded. So, all of those things had to take into consideration before I agreed to let us go down to participate in the Black Lives Matter March, which we did. So, we're right at this point, we're home. We've been home. We've been really good. Even though they opened the beaches a couple weeks ago, we have not been to the beaches. They opened them around Memorial Day weekend. We have not gone to the beaches until this weekend. So after we participated in the march, we went down to the beach. We spent a couple hours The beach that we went to was not crowded at all. And they did pretty decently with the social distancing at the march, because, there is more space on Oahu. So, we're kind of sitting back home now, kind of tucked in, just, monitoring ourselves. We wore our masks, of course.
Mm-hmm. Right. So actually participating in the protest as well, it can be nerve-wracking. Even as a viewer, just watching the protests take place, and the concern. We're seeing spikes across the country as various states are opening up, and so we're looking at the second wave. What are you hearing about this second wave?
Well, obviously, the protests, the opening up of communities and cities, restaurants, all those things where there are more contact, more likelihood for transmission, just to kind of wait and see what the numbers are. We do know here in Hawaii that after they opened the beaches Memorial Day weekend, prior to that, we've been having like one, new case a day, 0, 1, 0, 0. We had a couple of days in a row where we had 0. So the numbers are really low. They opened the beaches, and then this last weekend we had like the first big number for us, which was 6. And then it went back down to 1. They think that was a result of the beach opening on Memorial Day weekend. So, now we had the protests, we just kind of have to sit back and wait and see what the numbers are doing. The last couple of days since, I believe Saturday, we had 6 new cases. That was when we had the highest number in quite a while. Since then, we've continued to have 1, 1, 1, so it's dropped back down again. But, we'll just continue to wait and see what the trend is.
And with your patients who are testing positive, are you doing contact tracing to see who they came in contact with, and putting those people on alert to watch for symptoms or to get tested?
Yes, they are doing really good contact tracing here in Hawaii. So the one recent increase with the 6 new cases, they've been contact tracing that, and they believe that comes from one particular gathering.
Oh, wow.
A family gathering. Yeah.
Family gathering there.
Mm-hmm.
So what else can you tell us about the Native Hawaiian community there on our island, Oahu, and how they're combating this pandemic?
Well, I live just a couple miles from Waianae, which is the largest concentration of Native Hawaiians in the world. And, they also have been doing some protesting as well, but they've been doing what they call street protests. So they, all space out on the side of the street and sign wave. And they did that over the weekend, the last week, several days in a row. The Native Hawaiian population, they have had 76 cases total. That's in the whole of Hawaii. They do make up, which is 13% of the total positive cases, although the Native Hawaiian population is 21% of the total Hawaiian population, state population. So they're doing pretty good. But the Pacific Islander population, the Pacific Islands from the other islands, not Hawaii, American Samoa, Tahiti, Tonga, those other islands, they've been hit proportionally higher. So they're the ones that have a little bit higher infection rate here on Hawaii. But otherwise, they're doing what everybody else has been doing, which is following the guidelines, wearing masks, staying home. So they've been doing pretty well.
Wow. So, and it's just, they're not, all of the Pacific Islanders and Native Hawaiians are not, under federally recognized tribes. And so their
Right.
numbers is completely different than federally recognized tribes. A
Yes.
whole different column to count there. Well, last thought, really quick, Dr. Lawrence.
My last thought. There's so much going on in 2020. There's so much going on that it can be disheartening. It's just important for us to remember who we are and where we came from. And getting emotional. Our ancestral teachings, that we have to always be prepared because we never know, what's going to come. For us in Hopi, it's always be prepared because you don't know when the famine's coming. And so, we try to practice that all the time and just be prepared. Same thing with here in Hawaii. Now we're hitting hurricane season, which extends until November. So, we're getting ourselves prepared because we never know what's coming. And always keep positive and remember our culture and where we came from. We've survived for thousands of years and will continue to survive.
Dr. Lene Lawrence, thank you so much for joining us.
Thank you, Patty.
And thank you for watching. Take care of yourselves. Your life is precious. I'm Patty Tolohungva. Thanks for joining us.
This is Indian Country Today.